Okay, a very good evening to one and all. Welcome back to the last session of Perio webinars that we'll have. After this, we'll move on to our regular classes. Okay, because we are starting our regular classes from 1st of February. So in a week's time, we'll be starting with our regular classes. So we will all meet in micro, path, and perio with me. Okay, for today, we have a very small topic. I know it's a Sunday evening, so not taking much of your time, but just one small topic we'll study, and we'll study in and out of that. Okay, it's just the principal fibers of periodontal ligament. Nothing more than, nothing in details about any other thing, just principal fibers of periodontal ligament. Okay, can I get a feedback from everybody if my audio and visual is clear? Is my audio and visual clear? Okay. Okay, good. Thank you. Thank you. Okay, so we'll start with today's session. Okay. Yes. So we'll be just looking into the principal fibers of periodontal ligament. Okay. So first of all, what is a periodontal ligament? What it comprises of what, or what it is part of? Okay, so periodontal ligament is what, it's part of your periodontium. It's part of your periodontium. So what is periodontium first? Periodontium is a dynamic structure composed of tissues supporting and investing the teeth. That means periodontium is all those structures which either cover or support your teeth, invest the teeth and support the teeth. They constitute the periodontium. Okay, they constitute the periodontium. Now, what are the components of that? There are 4 principal components of the periodontium. What are those? The first one is your gingiva, and then your attachment apparatus, that is your PDL, cementum, and your alveolar bone. Okay, so we'll just draw a diagram so that we get an idea of it. This today is basically anatomy. Okay, so we'll just go through everything. What does somebody is asking, what does investing? Investing is nothing but containing the tooth, or it helps in housing the tooth. I'll show you how, what do I mean by that. Okay, it helps in housing the tooth. So this is the tooth, this is your alveolar bone. Okay, and then you have your gingiva here, and then comes your structures. So on the outermost part of your root, you have your what is this? This is your the outermost covering of the root. Can anybody tell me what is the outermost covering of the root? And then let's put green. And then you have the periodontal ligament fibers. Okay, all of you are responding to, yes, it is the cementum. Very good. It is the cementum. Okay, so now we are going to see all the structures. So first, what we talked is gingiva. So gingiva is right here. This is gingiva. So what is gingiva doing? It is covering the tooth. It is covering the tooth and covering the alveolar bone. This alveolar bone, outer cortical plate is covered, and it provides an attachment to the tooth. The gingiva provides an attachment to the tooth. Which portion of the gingiva provides attachment to the tooth? Can anybody tell me? Which structure of gingiva provides attachment? What is this structure that is providing attachment to the tooth? What is this structure that is providing attachment to the tooth? Can anyone tell me what is this structure? No, not the marginal gingiva. Marginal gingiva is here. This is the marginal gingiva. It is the free gingiva, not attached gingiva. Attached gingiva is here. This is your attached gingiva. Attached means it is attached to the bone. Yes, it is the junctional epithelium. It is the junction. Junctional epithelium is that part of the gingiva which provides attachment onto the tooth, which provides attachment onto the. So this is the junctional epithelium. So this becomes the most important structure in your periodontium, because which part of gingiva forms the actual component of your periodontium? It is the junctional epithelium. So they call it the dentogingival unit, called the dentogingival unit. The fibers and the junctional epithelium together is known as the dentogingival unit. We'll study all this in detail when we do gingiva. Okay, just giving you an overview. Okay, so that is your gingiva which is attached here. That's the first structure of the periodontium. Then you have the PDL. Here is your periodontal ligament. What does the periodontal ligament do? What does the periodontal ligament do? It provides attachment to the tooth and attachment to the bone. So it is that structure which attaches the tooth to the bone. Okay, a connective tissue structure which attaches the tooth to the bone. That is your periodontal ligament. And the space in which the periodontal ligament is contained, it is known as the periodontal ligament space. It is called the periodontal ligament space. That space in which where the periodontal ligament is housed, this area. This is known as the periodontal ligament space. Now my question to you, when you take a radiograph, how does the periodontal ligament space appear? Okay, how does the periodontal ligament space appear? Is it radio-opaque or radiolucent? Is it radio-opaque or radiolucent? Okay, I'm getting 1, 2 answers. Very good. It is radiolucent. It is radiolucent in the X-ray. Then your next structure is the cementum, which is the yellow color which we draw. Okay, and then the last is your alveolar bone. Which portion of the alveolar bone forms the part of the periodontium? It is the inner part of the alveolar bone, so inner cortical plate, or your alveolar bone proper. You call it as ABP, alveolar. This is the alveolar bone proper. Okay, which has attachment of the periodontal ligament into it. Okay, alveolar bone proper. Now, this alveolar bone proper, in radiograph, it appears as radio opaque. It appears as radio opaque. What do you call it? What is that radio opaque structure that you see in the X-ray? Very good, very good, very good, Preetham, very good. Jaya, Sneha, excellent. It is known as lamina dura. It is known as lamina dura. Excellent, very good. So this is some basic idea about the structures of the periodontium, different names, what we call it radiographically and histologically, what are the different names given. Okay, we'll study alveolar bone proper as multiple names, but just for your knowledge now, because the PDL goes into it, the PDL space is radiolucent and the alveolar bone proper, it is radio opaque. Okay, so that is about the periodontium. So periodontium is nothing but it is your gingiva along with your periodontal ligament, cementum, and your alveolar bone. Okay, today we are going to see all the fibers, not all, the principal fibers of the periodontal ligament. That is what we are going to see today. Okay, so we'll move on to the next slide for that. So before we talk about this thing, principal fibers, we'll just know from where it is developing. Okay, because that's a very common question. It is common to perio, it is common to dental histology, anatomy, everywhere it keeps coming. Okay, so they originate from fibroblast. Where is this fibroblast formed from? This is formed from your dental follicle. Very important. Okay, fibroblast. So the main cell that plays a role in periodontal ligament formation is the fibroblast. So they synthesize the fibers and the ground substance of the periodontal ligament. Where do they originate from? They originate from your dental follicle. Okay. Now, once these fibers are formed, they will form attachment into the newly formed cementum and into the newly formed bone onto the each ends. That is how. So on both sides, it will attach one side into the cementum and one side into the bone. Okay. Now this development part is very important because every year there is one question which comes from the development. So you should be having a clear idea what structure is forming from where. Okay. So today we are studying about what? We are studying about the periodontal ligament. So let's see the periodontal ligament cell, the fibroblast that is formed. Where is it formed from? It is formed from your dental follicle. This chart you should by heart it. Okay. When we go into the regular classes, in my notes, this paper will be there. Even in my discussion notes, this will be there. Okay. So this is one chart that you should by heart. So periodontal ligament cells, they are formed from the dental follicle. Sometimes in your options, there won't be dental follicle. The options will be ectomesenchymal origin, epithelial origin, all these kinds of things will come. So then we have to go one step back and see where it is starting from. These precursor cells are ectomesenchymal origin. They are ectomesenchymal in origin. So ectomesenchymal cells will give rise to your dental papilla and your dental follicle. That forms your pulp, cementoblast, PDL, dental follicle forms cementoblast, PDL, and your osteoblast. Cells from that differentiate into cementoblast, fibroblast, and osteoblast. Okay. In the same way, epithelial cells, once the crown formation is done, does it play any role in root formation? Some hypotheses are going on. Okay, so the inner enamel epithelium and the outer enamel together forms what? Your HERS. What is HERS? What does this stand for? What does HERS stand for? HERS. In inner enamel epithelium and outer enamel epithelium together forms HERS, which plays a major role in root formation. Yes, very good. Hertwig's epithelial root sheath. Hertwig's epithelial root sheath. Okay. Now, Hertwig epithelial root sheath, what is the end product? What is our final outcome of HERS? What happens to HERS? What happens to HERS? The proved outcome, what is happening to HERS? What we actually know 100%. Can you see these dotted lines? They are all hypothesized. Whereas the clear line says, okay, it has been proven. The other things are still studies are going on. Okay, so HERS, what happens? What we understand is that as the root formation progresses, the cells disintegrate and they are retained as this ERM. Can anybody tell me what it is retained at? As some remainings. Some remainings in the tissue. Very good. Epithelial rest of malassez. They come as remnants of epithelial rest of malassez. Okay, epithelial rest of malassez. Very good. Okay, so this chart is like a basic outline for you. So anytime you have confusion, you go back into this chart. And once you by heart this chart, any question you get from development, you will be able to answer it. Okay. So I hope for PDL, we know where it is coming from. It is coming from the follicle, dental follicle. What is the origin of dental follicle? Ectomesenchymal origin. Okay, very good. I hope that is all you need to take in today. Our topic is PDL fibers. We are gonna just concentrate on all the questions that are gonna come from that. Okay, very good. So moving on to the next one is the principal fibers, the topic for today. This is the most important element in the periodontal ligament. What is it comprised of? It is comprised of type 1 collagen. Very common MCQ question. Okay, very common MCQ question. What it is composed of? It is composed of type 1 collagen. The terminal portion of principal fibers inserted into the cementum and into the bone, they are known as Sharpie's fibers, which undergo calcification. Okay, so this is a histological picture that they are showing here. This one. See ABP. This is ABP stands for alveolar bone proper. We just studied now, which houses all the periodont. And this is the root. So we have the cementum here. And this, what you see here, is the periodontal ligament fibers attaching from the root across into the alveolar bone proper. Okay. Once they insert here, these fibers, they get calcified on both ends. Both ends, they get calcified, and they are known as Sharpie's fibers. Okay. They are known as Sharpie's fibers. So terminal portion of your principal fibers inserted either into the cementum or into the alveolar bone, it is known as your, what is it known as? As your Sharpie's fiber. Okay. Now the principal fibers, they are divided into 6 groups. What are those groups? They are your transeptal fibers, alveolar crest fibers, horizontal fibers, oblique fibers, apical fibers, and interradicular fibers. These are the 6 groups of principal fibers. This you have to by heart it. Transeptal, alveolar crest fibers, horizontal fibers, oblique fibers, apical fibers, and interradicular fibers. Now, out of all this, I have put one in red. That is the transeptal fibers. Can you tell me why? Why is this that one thing I have put in red and the rest all normal color? What is something different about transeptal fibers? Very good, Sneha. Very good. Okay, so the basic point that you should understand about periodontal fibers, basic point about periodontal fibers, where do they insert, where do they attach, or where do they start and where do they end? They start from a tooth structure, end in the bone. That is the basic pattern of your periodontal ligament fibers. That means they will either start from the bone, go and attach into the tooth, or from the tooth back into the bone. That is how it is. Basically, its role is to attach the tooth to the bone. But transeptal fibers are a group of fibers which do not have attachment. So it is classified both under gingival and your periodontal fibers. Okay, so the still discussions and what do you say, different things are going on to decide what to do with it. But it has been currently classified under principal fiber. So transeptal fiber is the only principal fiber which does not have attachment into the bone. Please note this. That is the only fiber that do not have attachment onto the bone. It runs from one tooth to the other. Okay, very, very important point. A question that can be asked. Okay, so please note that. Okay, so I hope this is clear. All 6 types of your principal fibers, what it is made up of, it is made up of type 1 collagen. And what do you call the terminal fibers of principal fibers which get calcified? They are known as your Sharpie's fibers. Okay. Now, let's see all these principal fibers, because our topic is that principal fibers. So we will see them in detail one by one. Okay, one by one, we'll see them in detail. Kindly explain this. Sujay, can you tell me what to explain? Which the principal fibers, we are going into the detail of that. Okay. So let me draw one picture next to this one also. Diagram, of course, I'm going to explain that. Okay, I'll explain everything in detail. This lecture is a very small, but whatever we are going to study, we are going to study in detail. Okay. Let me select. Okay. Previous one, transeptal fibers. We'll come into that. We'll come into transeptal fibers again. Don't worry. We'll come into transeptal fibers again. Okay. Let me just take the color. Okay. So now we are going to see the different types of transeptal fiber or different types of principal fibers. The first one we are going to see is the transeptal fibers. Okay. Transeptal fibers. How does it? It extends interproximally over the alveolar bone crest. See the diagram, how I have drawn this green one. That is why I've given it in green color. It is going over the alveolar bone crest. This is your alveolar bone crest. Okay, this is your alveolar bone crest. So how is this transeptal fibers going? If I draw two diagrams here, this is one tooth and this is the other tooth. And if this is the alveolar bone, alveolar crest fibers run like this over the bone, over the crest of the alveolar bone, from one tooth to the other, from one tooth to the other. That is your transeptal fibers. That is your transeptal fibers. That is, it runs from one tooth to the other, from one cementum of one tooth to the cementum of the other teeth without having any attachment into the bone. That is why it's still question marked. Is it a periodontal ligament fiber? Because it does not have any attachment to the bone. It does not have any attachment to the bone. Okay, so that is the course or direction of your transeptal fiber. This is your transeptal fibers. That is the course and direction. Now, what are the features of transeptal fibers? When you have periodontitis, when you develop periodontitis, what happens? These are the first fibers to get destroyed. Okay, and these are the first fibers to be reformed also when there is bone loss. Okay, so in this, if the bone loss occurs and the first fibers to be formed here, it's again the transeptal fibers. So if, for example, if I'm going to do a flap surgery in a patient with deep pocket with severe bone loss, as I open up the flap, there'll be severe resistance when I reach the crest of the alveolar bone, and there'll be thick fibrous structures there. These fibrous structures that form immediately along with the bone loss, it is your transeptal fibers. Okay, so they are the first fibers to get destroyed and the first fibers to be reformed in periodontitis or in case of severe bone loss. So that is your transeptal fibers. Is transeptal fibers clear? Is transeptal fibers clear? The course, from where to where it runs, and what it is its significance. Everybody, can I get a yes if it is okay? Then we will move on to the next one. Very good. So we will move on to the next one. That is your, so we finished the first one. That is the transeptal fibers. Now we are moving on to the second one. That is your alveolar crest fibers. That is your alveolar. From the term itself, it is somewhat related to the crest of the alveolar bone. So now we have to study two things. Always study the direction of these fibers and its function. You can get questions on these two things from principal fibers. Okay, so the alveolar crest fibers, how do they extend? They extend obliquely from the cementum to the crest of the alveolar bone like this. Okay, I'm just gonna repeat about the alveolar crest fibers. Okay, I'm going to start the alveolar crest fibers again. Alveolar crest fibers extend from the cementum. This is your cementum here. Just beneath your, so your junctional epithelium normally attaches here. The junctional epithelium normally attaches. So just beneath the junctional epithelium, these fibers start and they obliquely go and attach onto the crest of the alveolar bone. They go and attach to the crest of the alveolar bone. That is the direction of your alveolar crest fibers. From where? From the cementum, just beneath the junctional epithelium. Just beneath the junctional epithelium. From there to the crest of the alveolar bone, to the alveolar crest. That is the direction of your alveolar crest fibers. From the term itself, it is there. Alveolar crest fibers. So it starts from the cementum, just below the junctional epithelium, to the crest of the alveolar bone. That is your alveolar crest fiber. So now you can see it is fanned out like this. So what do you think it is trying to do? It is trying to pull the tooth and hold it there. So what are its functions? One is to prevent extrusion. To prevent extrusion. To prevent extrusion. See, extrusion means it is going to get pulled out like this. But the fibers are directed in this direction. So it is going to prevent extrusion. It is going to prevent the tooth from getting extruded out. And it prevents lateral movements. It resists lateral movements. So there are two functions of your alveolar crest fibers. What are those? Extrusion it prevents and lateral movements it prevents. It resists the lateral movement. So now itself you have to by heart it, because once we finish today, you should know the function and orientation of all these fibers. So alveolar crest fibers, I'm repeating again, it starts from the cementum just below the junctional epithelium into the crest of the alveolar bone, into the crest of the alveolar bone. What is its function? It prevents extrusion and it prevents lateral movement. Okay, it resists lateral movements. That is the alveolar crest fibers. I hope that is clear. Okay, now moving on to the third group of fibers. That is your horizontal fibers. From the term itself, it is very clear. They are horizontal to the tooth surface like this. So this is your horizontal group of fibers. That is, they are horizontal, 90 degree to the right angle to the long axis of the tooth. Right angle to the long axis of the tooth. Right angle to the long axis of the tooth. Okay, so what is the orientation? From the bone to the cementum, but at 90 degrees or at right angles to the long axis of the tooth. Again, remember, you're drawing horizontal lines, so it is preventing lateral movements. This also play a role in preventing lateral movements. Okay, that is your horizontal fiber. So till now we finished 3: transeptal, alveolar crest fibers, and horizontal fibers. Now we are moving on to the fourth one and the largest group of fibers. That is your oblique fibers. That is your oblique fibers. Okay, oblique fibers, they are obliquely arranged on the tooth surface in the periodontal ligament space. They are obliquely arranged from the cementum into the alveolar bone. From the cementum into the alveolar bone. What is its function? So it is the largest group of fibers and its main function is to see, it is the largest group. So what does the tooth always face? The maximum thing that the tooth faces, the vertical masticatory stress. Masticatory stress or masticatory load. Every time we chew, what is happening? The forces are coming down like this. The forces are coming down like this. Those forces, the maximum amount of those forces are taken up by your oblique fibers. They bear the vertical masticatory stress, convert that stress, or they take that stress and transfer it into the surrounding alveolar bone. That is their function. Okay, that is their function. What do they do? When the forces come, when vertical masticatory forces come, they take up those forces. They take up those forces and then transmit those forces into the surrounding alveolar bone. So when vertical forces come like this, they will take up these forces. They will take up these forces and transfer the forces into the alveolar bone. Transfer the stress into the alveolar bone so that it is dissipated, so that the force is dissipated. It is equalized like a cushioning effect. Exactly like a cushioning effect, because they are maximum in number and they are taking up all the load so that we don't feel any discomfort when we are chewing, when we are putting lot of our masticatory stress. I hope that is clear. So oblique fibers, they are the important points. They are the largest group of fibers. They are the one that take up maximum vertical masticatory stress. What do they do with that stress? They transfer the stress into the surrounding alveolar bone. Okay, so we are done with the oblique fibers, horizontal fibers, transeptal fibers, and alveolar crest fibers. Okay. Now we are left with 2 more. What are those? Apical fibers. From the term itself, it's understood where it is seen in the apical region. They are seen in the apical region. Okay, apical fibers, they are seen in the apical region, which are irregularly arranged. Irregular arranged. See, it is not arranged nicely like that, but irregularly scattered, arranged in the apical region. That is your apical fibers. Now, what all do? Their function is they prevent tipping of the tooth, resist forces of luxation, and they play a role in protecting all the blood vessels that are coming in. All the small, tiny blood vessels, they are coming in, the nerves that are coming in, they will protect. They will act as a cushioning for that area to protect the blood, lymph, and the nerve supply that are coming out through the cribriform plate of your alveolar bone. Okay, so what are the functions? What are the features again? It is seen in the apical region. It is irregularly arranged, prevents tipping, resists luxation, and most important one, protects the blood, lymph vessels, and the nerve supply in that region. So that is your apical fibers. So we are done with that. And the last one is your interradicular fibers. Where do we see this? Interradicular fibers. Where do we see interradicular fibers? Like, okay, molars. Why did you say molar? What is so special about molar? Somebody say multi-rooted teeth. Very good. Multi in the furcation area. Exactly. We studied in the last class about different types of furcation defects, everything. Okay. So it is seen in the furcation area. Where do you see it? It is seen in the furcation area like this. And you have your interdental bone right here like this. So it will be seen in the furcation area attaching into the bone like this. Sorry. Attaching into the bone like this. So it is seen in the furcation area. Very good. Interradicular fibers, they are seen in the furcation. Their function are similar to that of the apical fibers. Two main functions, that is prevent tipping and prevent luxation or resist forces of luxation. So what do they prevent? They prevent tipping, luxation, and rotation. These are the three features of the or three functions of your interradicular fibers: tipping, luxation, and rotation. Okay, so these are your principal fibers. What all you need to know about them? You need to know their orientation. You need to know their important functions and any specific features if they have. For example, in transeptal fibers, what is the feature? They are the first fibers to be destroyed and the first fibers to be reformed in periodontitis or in cases with severe bone loss. Okay, alveolar crest fibers. What is the feature? They are found obliquely just below the junctional epithelium from the cementum. Starts from the cementum, remember, okay? Starts from the cementum and enters into the crest of the alveolar bone. It is like this. They are arranged like this from both sides. So what is the function? They prevent this and they prevent this. What is that? Extrusion and luxation. They prevent extrusion and luxation. Then we have horizontal fibers. Nothing but they are 90 arranged 90 degrees like this on both sides. So along with the line, you can put cross here. What do they prevent? Again, they prevent lateral movements. They prevent excessive lateral movements. Then the most important one, the oblique group of fibers. They are the largest group of fibers. They are the largest group of fibers, and they are the one which take the maximum vertical masticatory stress. They take the stress and then they transform it into or they transfer it into the alveolar bone. Okay. Then you have your apical fibers seen in the apical region, irregularly arranged. What are the functions? Prevent tooth tipping and luxation. But another most important feature is to protect the blood, lymph, and the nerve supply in that apical region. Okay. And the final one is your interradicular fibers, where it is seen in the furcation area. It is seen in the furcation area in multi-rooted teeth. Okay. Multi-rooted teeth. Function is similar to that of apical fibers. Prevent tipping, luxation, and rotation. Okay. So this is your principal fibers of your periodontal ligament. Is this clear? All the direction, orientation of the fibers and its function. When you leave today, you should be clear about this so that you don't have to read about this again. Okay, very good. Okay, so now moving on. Last small topic. There are two theories that are associated with the principal fibers or with the fibers of the periodontal ligament. Okay, how they take up the load. Transeptal fibers. Okay, I'll just draw here, and there's some doubt about transeptal fibers. Let me clear it now itself so that this is your tooth here. This is your bone here. Okay, the transeptal fibers, they run like this. You understood? They run from one tooth to the other tooth, from one cementum of one tooth to the other cementum of the other tooth above the crest of the alveolar bone. Above the crest of the alveolar bone. Basically, they do not have any attachment into the bone. Okay, that is why the question mark is still put, or that is why it is still classified under gingival fibers and periodontal fibers. Okay. And what is the other thing that we studied about this? This transeptal fibers, they are the first one to be destroyed when there is periodontitis. Out of these fibers, the first one to be destroyed is that, and it is the first one to be reformed also. So if you take a patient with severe bone loss, the only one fiber which you can be 100% sure which will be present there will be the transeptal fibers. Okay, because it has a tendency to reform. It has a tendency to form fast. Okay, I hope this is clear. Orientation of your transeptal fibers and what is its feature. Okay. Now coming to tensional theory and your viscoelastic theory. These are two theories which explains how your periodontal ligament plays a role in taking up the masticatory stress. Okay, basically theories explaining how periodontal ligament takes up the masticatory stress. Okay, now we'll see what are those. You have your tensional theory and your viscoelastic theory. Tensional theory and viscoelastic theory. Now let's see what is the basic difference between both. What is the basic difference between both? Okay, in simple words, if I say this favors principal fibers, or tensional theory states that the principal fibers play a major role in supporting tooth and transmitting forces to the bone. Okay, that is what so the major role is played by the principal fibers. Whereas viscoelastic theory states that the most of the force is due to the displacement of tooth is largely controlled by the fluid movements. It is due to the fluid movements that is occurring within the periodontal ligament space. It is due to, and principal fibers play only a secondary role. They only play a secondary role in taking up the masticatory force. Okay, so that is a basic difference between both. Tensional theory goes completely for principal fibers. They say that the principal fibers is the one which supports the tooth in taking up the load. Whereas viscoelastic theory states that when forces are acted upon the tooth, it is due to the displacement of the fluid within the periodontal ligament space, which take up the maximum load. And principal fibers play only a secondary role. Okay, so that is a basic difference between both. Now let's see what is one theory and the other one. How are they explaining it? What is the theory behind it? So in tensional theory, when the force is applied, so let me draw a tooth here so that we can understand what we are saying on one side and on the other side. So on this side, it is when it's in a normal situation, when the PDL is in a normal situation. Okay, no mastication, there is no vertical stress. Vertical stress is not present here. Vertical stress is present. Okay, on the just dividing the tooth on two sides and showing, so it's easy to draw and show. Okay, so here it's when the tooth is resting. You can say when the tooth is resting, what happens? All the principal fibers will be curled up. Okay, it will be folded up or curled up and everything. But when there is more vertical masticatory stress acting on the tooth, what happens to these principal fibers? They all stretch. They all straighten out. Can you see the difference? What I am trying to explain. On one side, when it is resting, it is all folded up or it is curled up together. It is not under stress. But as soon as you apply force, as soon as you apply vertical stress onto it, what happens? They all stretch. The principal fibers stretch out. And once they stretch out, what do? The vertical stress that is coming through the tooth, that is transferred through the stretched fibers into the alveolar bone. It is transferred into the alveolar bone. So what they're saying, when the force is acting, the principal fiber stretches and the forces are transmitted into the surrounding alveolar bone. And this alveolar bone will dissipate these forces by undergoing elastic transformation. Okay, like I said, alveolar bone has a good capacity to undergo elastic deformation. Okay, so when the forces come to the PDL, PDL transfers it to the alveolar bone, and the alveolar bone try to dissipate the force by undergoing elastic deformation of the socket. That is how the forces are dissipated. Okay, but sometimes the forces will be too much for the alveolar bone also to take up. Will be too much for the alveolar bone also to take up. So what does the alveolar bone do? What does this alveolar bone do? Just the alveolar bone is based inside the basal bone. Okay, that means your mandible as such. Okay, so if I draw the mandible for you to understand, if I draw the mandible like this, each of this forms the alveolar sockets, and that forms the alveolar bone proper. So first the force is taken up by this part of the bone, but if it is too much, what happens? The load is then transmitted from here into the surrounding basal bone. It is transmitted into the surrounding basal bone, and the basal bone takes up the force. You understood what is happening in tensional theory? So from when the force comes, first it acts on the PDL. The PDL stretches. As it stretches, it transmits the forces into the alveolar bone proper. It transmits into each of these alveolar sockets. The alveolar sockets try to undergo elastic deformation and to dissipate the force. If the force is too much, then from here it is transferred on to the basal bone for the forces to be dissipated. That is your tensional theory. That is your tensional theory. Okay, I hope that is clear. Now we are moving on to the viscoelastic theory. Viscoelastic theory. Now what does viscoelastic theory state? So this is the tooth. PDL space. You have your PDL fibers also here. Okay. Now what does the viscoelastic theory state? When forces are transmitted to the tooth, the extracellular fluid which are present in the periodontal ligament, that is what I've drawn it in the green, this thing, the extracellular space fluid which are present in the periodontal ligament space, moves into the alveolar bone, through the spaces. This alveolar bone has, if I draw it like this, let me draw it. This alveolar bone has lots of pores on it. Alveolar bone proper has lots of pores on it. And that is why alveolar bone proper has one more name. Can anyone tell me what is the other name? One radiographic name we studied is lamina dura. Can anybody tell me any other name for alveolar bone proper? Very good. It is known as cribriform plate. It is known as cribriform. That means lot of perforations in them. Okay, so what I was telling is that when the forces are acted upon the tooth, instead of the principal fibers taking up the load, the fluid here, it acts as a, a cushion. The fluid takes up all the force and the fluid flows out through these cribriform plate into the marrow spaces. So extracellular fluid passes from the periodontal ligament space into the marrow space of the bone through the foramina of the cribriform plate. Okay, so initial load, it is dissipated by the fluid moving away from the periodontal ligament space. Now what happens? There is no fluid present here. So that is when your periodontal ligaments will take up the secondary role. So from here onwards, the secondary role of the periodontal ligament fiber starts. What do? Once the fluids are depleted, the fiber bundles will absorb and slack and tighten. Just like before, the fibers will get stretched. In both directions. Now, once these fibers will get stretched, what will happen? There are a lot of blood vessels around these fibers. These blood vessels also will get stretched, and these vessels will undergo stenosis. Stenosis meaning if it is like this, it becomes thin. Narrowing, it becomes narrowed. So what happens? There is arterial back pressure leading to ballooning of the vessels. And because of that, from these blood vessels, the ultrafiltrates will move into the periodontal ligament space. So, or from these PDL fibers get stretched, the blood vessels tighten, and from the blood vessels, more fluid will replenish this area. So whatever fluid was gone, that will get replenished by the stretching of the PDL fibers. Because of the stretching of the PDL fibers, the blood vessels will get stenosed, arterial back pressure will increase, ballooning of the vessels, and passage of the ultrafiltrates into the PDL space, which will what? It will replenish the tissue fluid. Okay, so what is the PDL actually doing here? They are sorry, they are replenishing the fluid that are displaced due to the masticatory load, so that there is more fluid to take up the continuous stress of masticatory load. Okay, that is your viscoelastic theory. Is it clear? Tensional theory, primary role by the periodontal ligament fibers. Here, primary role is by the fluid in the PDL space. Fluid in the PDL space. Okay, so I hope that is clear. I have got a feedback from everybody saying that they understood both the theories. So now this should be with you forever. This concept you should not forget. You get any questions, how is the fluid replenished, or what is an how is the ultrafiltrate formed, or how is the ultrafiltrate escaping out? It is through the cribriform plate, through the foramina in the cribriform plate. What is tensional theory? Which theory involves principal fibers playing the primary role? Which theory involves principal fibers playing the secondary role? These are the different types of questions that you can come across. But if your theory is strong and clear, you will not have any difficulty in answering any of these questions. Okay, so what you should do today itself, go back to any of the MCQ books and try to find questions related to just PDL fibers and try to answer them. So now you have understood all the things related to PDL fibers, especially principal fibers. You should be able to answer it. Okay. If you have someone here doubt, come back for the next session and then we'll clear it there. Okay. So I'm just clearing out these drawings. I hope this is clear. We'll move on to the next slide. Okay. So with that, to the questions now. Okay, so we'll do the 5 questions related to all these topics that we studied. Very easy ones. You can give me the answers. Okay. So coming on to the first question. Most predominant connective tissue cell in the PDL that we already studied. Fibroblast. Okay, fibroblast. Where is the origin of the cell from? Where is the origin of the cell from? Can anyone tell me where is the origin of this fibroblast from? Very good. Dental follicle. Is it an epithelial origin? Is dental follicle, is it an epithelial origin? It is an ectomesenchymal origin. Very good. So all 3 points are now clear. All 3 points are ectomesenchymal, dental follicle, fibroblast, PDL. That's it. It should be etched in your brain now. Okay, you should not forget it. So question number 1, answer is fibroblast. The answer is fibroblast. 1B. Very good. Everybody gave the correct answer. Question number 2. Periodontium include all except. Again, easy question. Periodontium include all except. Oh my. Somebody and all made some mistakes. Like I said, please don't hurry up and see some change in the wordings and go for an answer. Okay. Very good. It is dentin. Bone lining the socket. Instead of writing alveolar bone proper, they wrote bone lining the socket, just to confuse you. But dentin is not part of the periodontium. That is what first you should look for. Okay. So like I said, knowing the theory and understanding the concept is very good. But when you answer a question, never ever jump and answer. Always read, go back to your concepts and see what all the points are there, and then only answer. Okay. So bone lining the socket. What is bone lining the socket? It's alveolar bone proper. So that is correct. PDL is correct. Cementum is correct. But sir never talked about dentin. We never talked about dentin. Okay, because dentin is just part of your tooth structure. It has nothing to do with periodontium. It has nothing to do with periodontium. Okay, so question number here again, see, it's except. All these things you should note. Okay. Question number 2, answer is D. Okay. Moving on. Sorry. This theory states that the principal fiber play major role in supporting the tooth and transmitting forces to the bone. Now it's very easy. Which is that? Yes, it is your tensional theory. It is your tensional theory. It is your tensional theory. So how does the force? When forces come, it is first transferred into the PDL, from the PDL into the alveolar bone proper or the tooth socket, and from there into the basal bone. This is the pathway of how the forces are transmitted. In viscoelastic, if we want to draw the same, easy to remember, forces acting onto the tooth, what happens? The fluid in the PDL space, they move out into the bone marrow through what? Through your cribriform plate. They move out into the bone marrow. So once the fluid is gone, then the secondary role of the PDL fibers start. What do they do? They stretch, and what happens? The blood vessels will undergo stenosis. Plus ballooning, leading to what? Production of ultrafiltrates, which will fill up the PDL space, Okay, that is how the viscoelastic theory works. Okay. So question number 3, the answer is tensional theory. I hope this is clear. Which of the following fibers are first to be destroyed during periodontitis and first to be reformed? Okay, very common question. It has been asked multiple times. Yes, it is your transeptal fibers. It runs from cementum of one tooth to the cementum of the other tooth without any attachment onto the alveolar bone. So it's the only principal fiber which does not have attachment to the alveolar bone. Okay, very good. So question number 4, answer is C, transeptal fibers. Last question. Okay, fibers that prevent extrusion of the tooth. It should not come out like this. So there should be some fibers which is pulling down the tooth like this and resist lateral movements. They are known as. Immediately draw the diagram and try to correlate. What did we study? Okay, so the tooth is being tried to be pulled out like this. It's tried to be pulled out like this, but there is some fibers which is trying to keep it grounded. And those are your very good. Those are your alveolar crest fibers. Okay, in question number 5, which group of fibers is the one which you see in largest number? Out of this, which is the option which you see in largest number? Very good. They are the oblique fibers. Which group of these, which of these options is the answer for fibers seen in the furcation area? Yes, furcation area. It is the interradicular fibers. Very good. So it's a small topic with a lot of questions that can come, but I hope that you have understood the topic, understood the concept, and there's no need to by heart now, but you have a pictorial presentation of everything. I used to study like this. Draw everything. Draw as much as you can draw. Whatever your imagination is, draw it and keep it next to your notebook or next to your MCQ books. Draw and keep. You will never forget it. Okay. So that is it. So question number 5, answer is D. So with this, we come to the end of today's session. Okay. Thank you so much for your patient listening and for your active interaction. Okay. I hopefully will see all of you for the regular sessions in our batches. So we will be meeting for perio, path, and microbiology. Okay. Yes. And please make sure that you attend the next session also, another free webinar, which is tomorrow. Okay. That is by Dr. Shrestha. Okay. The topic is impression materials. And any of you who are joining in for the first time, if you are interested in joining our batch, the batch starts on 1st of February. Okay, you can contact any of these numbers to enroll yourself. Okay, thank you so much. Take care. Have a good day. Bye-bye.